I'm EZRAH here to walk you through today's burning issues and the biggest stories. Voluntary mask wearing, traveling, and in-person classes. The world seemed to have moved on from the COVID-19 pandemic. At 2023, the public has been entrenched into the new normal. However, 26 out of 82 provinces in the country are still under COVID-19 alert level 2. Is COVID-19 still a threat to public health? Here to shed more light on the matter is public health expert and health reform advocate, Dr. Tony Leachon. Good morning, Doc, and welcome to the Manila Times. 26 provinces are still under COVID-19 alert level 2 since June of last year. Is this something the public should be concerned about?
Well, it's something that the public should be concerned about, but we should not panic because most of these cases will be milder. I think one thing that the public should understand is that the World Health Organization has declared last January 30 that the world is still under public health emergency international concern, and we're not yet on the endemic stage. We're actually on a transition point, and every quarter of the year they would um, give some updates as to the status of the COVID. Now, as we speak right now globally, we need to have an environmental scan. There's an increase in cases in India driven by a subvariant known as Arcturus or XBB.1.16. And the World Health Organization has alerted many countries. And we see also increased cases in Malaysia and Singapore. And in the United States, this Arcturus has actually occupied or actually afflicted about 7% of the population. Now, in the last 2 weeks, I have been alerting the public to online and as well as social media and traditional media stations that the positivity rate has gone up from 5%, which is the benchmark of the World Health Organization, to 8.8%. And this means there's an increase in the transmission rate brought about by mobility. Number two, opening up the economy to foreign investors. Of course, the push of the tourism industry, and of course, the arrival perhaps of subvariants, which we cannot monitor because of the lack of genomic sequencing. Now, I would laud the technical working group of the IATF.
Dr. Tony, you mentioned there is a new variant that we should watch out for, one from emerging from India. So tell us about this new variant and what are the symptoms of this new variant?
Well, this variant is known as Arcturus. It's actually descendants from the Omicron variant. And basically, it has driven the surge in cases in India. The usual symptoms are the following. You have fever, cough, sore throat, and of course, body malaise, and then, of course, the usual flu-like manifestations of Omicron. But there's one unique manifestation, and that is sore eyes or conjunctivitis or sticky eyes. So this should be something that we should watch out for. But we should not panic because these are milder cases. And I don't think that there will be an increase in the hospitalization rate in our hospitals. And I can assure the public there will not be any economic lockdown, basically because of the milder cases that we're seeing right now, not only in the Philippines, but also in other parts of the world.
Doc, the government recently has given a go signal on second booster shots, not just for the vulnerable population, but for everyone. Do you suggest that everyone should get that second booster shot?
I think this is a welcome opportunity that we consider the booster shot because the general population, the younger population, is actually the vulnerable one. Based on the Philippine Statistics Authority, the ones who are afflicted with the more common killer diseases like heart attack, stroke secondary to hypertension, neoplasms are actually in this age group. That's number one reason. The second reason is that they are the economic workforce, and we should keep the economic workforce healthy, because if we have sick workforce, that would mean also a sicker economy. So if we want to keep the economy afloat, then we need to protect the economic workforce and make them resilient and make them healthy. And I think that's the most important situation. Of course, number three reason, we don't want to reduce their quality of life. And of course, getting the infection, they can that may be contracted from some sources, they can actually bring it home and affect the more vulnerable segments, and that their parents or their grandparents. And of course, the occurrence of the long COVID syndrome, the persistence of symptoms, even beyond the positivity of the COVID.
Sir, you mentioned earlier that the younger population is more vulnerable to these new variants. So how old are we talking about? Like, what's the age range?
Well, of course, we know that the prioritization will be based on the previous segments, that healthcare workers, A1, then A2 senior citizens, and then the economic, then the comorbid conditions, and then the A4 with the economic workforce. Now, I'm just adding right now a new idea and concept that based on the Philippine Statistics Authority, the young ones are the ones afflicted with heart disease and hypertension leading to stroke, cancers, and of course diabetes. So I think it would be a wise move that to involve the general public, because the young ones are now afflicted with the non-communicable or lifestyle diseases. Gone were the days when we say that lifestyle diseases are actually diseases of the elderly and the rich. It is not. Lifestyle diseases are the diseases of the poor and the young. And that's what we're seeing right now in the clinics, and of course by the local authorities, particularly the Department of Health.
Dr. Tony, lastly, you mentioned that the COVID positivity rate is increasing continuously, little bit by bit. So what is your advice to the public to protect themselves from COVID-19 and to avoid any spike of cases?
I think we need to go to the basics of maintaining our minimum public health standards, and that is wearing our face mask. I think the mayor of Manila is thinking about restoring the mandatory wearing of face masks because of the increase in the cases. I think that's something that the government should think about. I think I would advocate the mandatory wearing of face masks at this point in time, based on three principles. I think we should be kind, because we don't know the next person may be actually afflicted with some comorbid condition. I think we should be humble enough to realize that the COVID is not yet over. And number three, we had to have a sense of community if we want the businesses to continue. I think that's the essence. And of course, we need to improve on our air indoor quality. We need to do physical distancing. That's what the government is doing right now. By alert level 2, it means that 50% of the establishment will have only 50% full capacity for establishment and 70% for outdoors. It means they are actually promulgating or implementing right now physical distancing. I think this is important. And of course, washing of hands and all of these things related to hygiene should be maintained. And the last one would be to promote vaccination, particularly the arrival of the bivalent vaccine should be facilitated, considering this would address not only the old Wuhan strain, but also the new variants that you might be confronted or we might be facing at this point in time.
Public health expert and health reform advocate, Dr. Tony Leachon, thank you so much for your insights.
Thank you very much. Thank you very much.